Well, hello, everyone, and welcome again to the podcast. And I'm really happy for you to get to know today Dr. Sharon Niv. Hello, Sharon. Glad you're here.
Hi, Gordon. It's so nice to be with you. Thank you.
Yes, and Sharon is her company is Joyous Team. Is that I'm saying that correctly? And
That's our
today we're
website. Yeah.
yeah,
Mhm.
yeah. Joyous.team. So yeah, and you'll get to hear all about that. But Sharon, as I begin with everyone, tell folks a little more about yourself and how you've landed where you've landed.
Absolutely. So my background is cognitive psychology. That's my doctorate work. Now, at the time, I was doing the coursework for clinical psychology, but didn't end up going through with internships. So I am not a licensed clinician, but my whole life I've been just a therapy groupie. And after I graduated from my psychology work, I began looking for ways in which technology can scale well-being. So I did some work in neurofeedback. I did some work in virtual reality aimed at helping people get better relationships with their chronic pain. But always, I was a pretty serious meditator. And I really believed in the power of practice and the power of skill building to help individuals come to better mental habits that can really promote well being. And at some point, I was met with the opportunity to explore the low dose ketamine pathway as a potential company to start to scale some of these available technologies as well. And what really attracted us about low dose ketamine as opposed to high dose ketamine is that it's extremely gentle and we love high dose ketamine. We love the psychedelic opportunities, but they're just a very different animal than what we're doing here. What we're doing
Hmm.
here with these doses that we're calling psycholytic, that is a technical term, but it's not so well known. So I do want to highlight that term is
Uh-huh.
giving people repeated experiences of a very gentle state of openness. And I'm happy to describe sort of the cognitive
Hmm.
facets of this state and why it works so well when it makes sense to do that. But these repeated exposures to the state really help our patients and then in therapy, the clients who bring it into their therapy sessions gradually build skills with a what one therapist described as a blanket of safety.
Hmm.
So there's
Hmm.
this somatic experience of spaciousness. Ketamine is a anesthetic dissociative. And so, of course, at high doses, that means people can be completely out. But at low doses, it means that they have a slight sense of distance between their sense of self and the somatic sensations of their body. So when I learned about this potential state,
Hmm.
it reminded me of so much stuff that I learned in my meditation work, where
Hmm.
you can drop into a sense of awareness and from there have, I would say, like the observer stance, the mindful
Hmm.
stance, where you can see things arise for yourself without being so identified with them that it's overwhelming that you cannot make progress. So as I
Right.
learned about this opportunity, I became very, very excited to co-found Joyous. We are a public benefits corporation. We've been live for about 3.5 years. First patients in July of 2022. So far, 83,000 patients. And
Wow.
the outcomes have been really, really significant. Happy to get into any of that, whatever interests you, Gordon.
Yeah, yeah, sure. So I know that, the whole use of psycholytics or the my mind's drawing a blank, the word I'm looking for, the
Psychedelic or
psychedelics,
no?
yeah, and all of
Yeah.
that. It's been around a little while now. I'm trying to remember when I first started learning about it. I guess it was like,
Hmm.
maybe a little before COVID, which is interesting
Yeah.
how we mark time now, but I think more and more people are discovering it. I know I've even had clients they didn't come to me, obviously, they didn't come to me for that, but they had worked with other therapists that had done ketamine treatments. And
Hmm.
yeah, so maybe for folks that might not be quite as familiar, you want to kind of pull back the curtain and tell us a little bit about why it works, how it works, and why it works.
Yeah, sure. Let's start with how it works. So, when people have heard of higher dose ketamine assisted psychotherapy, typically what happens is clients, I'm going to use the therapist vernacular, clients come for 3 to 4 hours. You do some preparation work, you maybe meditate a little bit. They then take a very high dose, and then they typically lie down with eye shades, and they go through a journey. There's not so much of an intentionality. Well, that's not true. You can set an intention, but you can't intentionally direct your attentional system. You are on a ride of your subconscious. And that can be a beautiful and therapeutic thing. Again, I am not opposed to high dose at all. And then afterwards, there's some integration work that happens. Typically, there's a preparation session before this 3 to 4 hour period, and an integration session after. And it can be a very transformative experience. I think the term that's been used is epistemically transformative. Like, it really can shift things for you in a huge
Mm-hmm.
way. Psycholytic therapy is very different. The ketamine experience lasts about 40 to 60 minutes, kind of depending on people's metabolism. So it fits within a regular period of therapy session. And the experience itself is so gentle that patients remain fully oriented. That is, they know exactly who they are, where they are, what they're doing, and they can be extremely intentional with their attention system. It's just that they're operating from a little bit of a sense of safety and spaciousness. I'll get into the cognitive science in a second, but
Mm-hmm.
one of my best friends is a psychiatrist who went to the MAPS conference, Psychedelic Science, I think in 2023. And there was
Uh-huh.
a session held live with Dick Schwartz and I believe Sunny Strasberg, where they did a couples therapy session on psycholytic ketamine. And
Oh,
her
wow.
quote, I love to say it because it's so funny and so true. She was like, it was really boring to watch because it was just a regular session. It was just going well. So I think what that illustrates there is if you get your clients coming in and they are less resistant, more open, more prone to insight, and more neuroplastic, because the ketamine itself is a neuroplasticity agent, it just tends to go better. You
Mm-hmm.
know,
Mm-hmm.
they're able to go there with more ease because they're not feeling overwhelmed by the nervous system sensations that are typical of negative emotionality and a history of trauma, attachment wounding. When we think about what it means to have issues in mental health, it is typically about the unpleasant bodily sensations associated with depression, with anxiety, with nervous system dysregulation related
Mm-hmm.
to past traumas. And of course, those can be so overwhelming that people tend to avoid and resist going there. And exactly the mechanism of ketamine is that spaciousness, that partial dissociation. You suddenly feel a little bit bigger than your body. There's a sense in which people can describe it as being permeable. I'm both inside
Mm-hmm.
and outside my body. I've heard someone say, it feels like I'm in a big room now. My body
Mm-hmm.
used to be my body, and my nervous system sensations were overwhelming. And now I'm the whole room, and the nervous system sensations are still happening there, but they're relatively so much smaller that they're not as intimidating. I can work with them.
Mm-hmm.
I can be present with them and allow them to be fully felt and released. So these are
Right.
some of the things that happen in a ketamine session with a therapist, and often spontaneously when they do it on their own too. But of course, having a therapist present is only going
Mm-hmm.
to enhance outcomes.
Yeah, to kind of direct where things are going. Yeah, yeah. And
Yeah,
from what I know and have learned about this, it's not it's comparing apples to oranges, but much like EMDR, it causes your brain to process things differently and really change the way that you process the story. I mean, it's been fascinating for me. There's a podcast that I listen to pretty regularly. Now, I'm not promoting them by any means, but it's called the Hidden Brain, and they talk a lot about and for particularly with people with trauma or even in relationships, when we begin to process and think about the situation differently, it takes on a new meaning, and then we can manage all of that in a much different way. Yeah.
100%. Yeah, it's
Yeah.
interesting you bring up EMDR for two reasons. The first reason is that it's often an example I give to therapists who ask, who is a good fit for this kind of therapy? And I
Mm-hmm.
often tell them something like, if you think a client is well matched to EMDR, that is, they have work to do, perhaps they have some plateaus, but they're resourced enough that they're not going to fall apart completely if they reach
Mm-hmm.
upon some deeper material, they're probably a good fit for psycholytic ketamine therapy as well.
Right.
So it's a good comparison on that front. But then exactly what you're saying mechanistically, both EMDR and psycholytic ketamine are involved in memory reconsolidation. which basically means, any memory we have is kind of like well, not any memory. A traumatic memory tends to be a full brain activation. And with that, there's a simulation that happens in the body of the original nervous system response. And that's exactly why it's still traumatic. You're
Right.
re-experiencing the overwhelm that happened and didn't get fully processed and released. And so what memory reconsolidation means is that that memory can be pulled up, brought into active working memory space. But then as the nervous system sensations do resolve and release, it can then be restored, that memory, separate from those original sensations, so that later it can be viewed semantically, or perhaps people describe it as viewing a movie, right? Rather than re-experience it in first person.
Right.
Yeah,
Right.
in the more
That
autobiographical memory
kind of
sense.
puts it in a place of not being something within themselves, but outside themselves.
100%. Well said.
And borrowing from the ideas from narrative therapy, the problem is the problem, not the person is the problem. And
I
yeah,
hadn't heard that.
yeah,
That's great.
yeah, yeah,
Yeah.
yeah. So that's good. That's good. So, yeah. So, what else do you think is important for people to know just about using low dose ketamine and that whole process? And maybe just talk. That's a good segue into talking about what Joyce does and
Mhm.
how you kind of came up with that and how that's evolved.
Sure. So I'll start with Joyous generally. Our mission is to increase mental wellness and mental health, and to do it as accessibly and affordably as possible. So if people don't know what a public benefits corporation is, we are a regular corporation, but in our structure, we're sending a message to potential shareholders that mission comes above shareholder value. So we are allowed to make decisions that benefit the patients over the shareholders, which is great.
Mhm.
And so part of that affordability, accessibility piece is we really wanted to be the most affordable approach for people who are looking to try to work with this medicine but can't afford the $2,000 IV treatments or don't have Spravato covered by their insurance.
Mhm.
So that's how we started out. And the protocol itself is at least in the beginning, a daily protocol. We have a pretty extensive mechanism for making sure that the right patient gets the treatment and the wrong patients do not. So there are some written intake forms. There is an online evaluation with a medical prescriber, and a couple of different points where we try to rule out any psychiatric contraindications, medical contraindications, contraindicated medications, and perhaps some like instabilities in life too that mean this might not be the right time.
Mhm.
So assuming that the patient gets through all of these, potential screening points, they then receive their medication straight to their home, and we begin giving them daily guidance on exactly how much to take and when to take it. So they're
Mhm.
taking daily check-ins that look at symptoms, they look at side effects, sleep, mood, general outlook on life, and a couple of other things. And through that, the system starts to learn you should be taking a little bit more, you should be taking a little bit less. You perhaps take it earlier in the day, perhaps it's disrupting your sleep, things like that. So it is very personalized how we recommend that they take their medication. And along with
Mhm.
that, we have some digital therapeutics in an online portal where they can communicate with other patients, and we do some live meditations as well. Now, and the reason that we're digital therapeutics is because due to the fact that we want to be the most affordable, we know that not all of our patients can afford therapy. So we know
Mhm.
that something like 40 to 45 or 40 to 48, depending on the survey we sent out, of patients already have therapists. Awesome. This is where Joyce for Therapists came in. The other guys,
Mhm.
unfortunately, we haven't democratized mental health care to the extent that we need to. So we try to provide them with digital therapeutics. That said, so we started asking the patients who told us, hey, I'm already in therapy. Have you ever considered bringing it into your own therapy session? And we found out that 30% of those guys, so we're estimating something like 15% of our total patient base, has already tried this with their therapists.
Mhm. Wow.
And it's which is really interesting. And the ones who responded were uniformly, it was 70% positive and about 25 to 30% neutral. Like it didn't move anything one way or another, but no negative. We had zero people say there was a negative outcome of bringing this into therapy. So
Right.
we started looking into what it would look like to train therapists. Because if they're going to be doing this, first of all, therapists by their nature and understandably are cautious people. They have like
Right.
people's lives and deepest truths in their hands. They also have licenses to protect, and all of that means they're cautious and they want to know what they're doing. So we partnered with a school called Palo Alto University, which is a fully APA accredited institution. They have like a consortium with Stanford University for their PsyD program, and they have an online CE credit portal for programs of that sort. So we partnered
Hmm.
up with them, and yesterday was the final module was sent in for a certificate program that we're going to be coming out with in November.
Oh.
This certificate program will teach people the basics and some advanced topics in what it means to bring psycholytic ketamine into their therapy. Now,
Hmm.
what we think of this value proposition for therapists is one, the training required here is considerably lesser than the training required for psychedelic therapy. There's just very little risk for medical or psychiatric emergency. So while training, of course, is always important, the degree of acuity necessary for extensive training, it's just not the same animal.
Hmm.
Two, this allows therapists to do their work. So I've heard from enough therapists in the program, I did the high dose stuff and some of it's really transformative, but it was just me sitting there with a client lying on the floor with eye shades on, and I'm not using my skills. I use my skills in the integration session, but with psycholytic therapy, I'm an active participant as
Hmm.
I'm doing what I already do, just with a client who is more open and less resistant and able to go there and derive the insights that they've been perhaps seeking and not breaking through to.
Right.
The third thing is we wanted to make this free. So the program itself is free to therapists. We are working on ways to securely, HIPAA compliant, connect between therapists and patients so that if the patient is willing, we can share outcomes, collaborate with the therapist, tell them what we know. I'm working currently on some AI driven, digital therapeutics that if the patients want to participate and they want to journal just a couple of sentences after each session, we would be able to provide therapists with additional insight on how the patient is doing throughout the week as well. So we're really hoping we can
Hmm.
create an ecosystem that is really mutually beneficial to everyone.
Hmm.
I will say I want some skin in the game when it comes to the certificate program. So there's going to be some nominal cost. I'm thinking like $200, but I am going to put out a forum for requesting financial aid. And honestly, for any reason, we'll give financial aid. Like,
Right. Right.
sliding
That's
scale down to
great.
zero. If you're a young therapist, if you're working primarily with, low income population, whatever, as long as you're willing to fill out an application, take it. We want you to
Right.
have these skills. These are really powerful sessions that integrate into your usual schedule. You don't have to schedule
Hmm.
3 hours, 4 hour breaks, and
Right.
and they're powerful. And they're powerful.
Yeah. Right. Right. So, yeah, you want to maybe walk us through kind of a typical session
Mhm.
and just kind of maybe some hypothetical issues and maybe I don't know. I'm just thinking off the top of my head, maybe a case example or two.
Yeah, sure. So a typical session may start out with, I will say people have different preferences for when to take the medicine. I've heard everything from I like to take it at the very beginning of the session so that my experience, the psychoactivity sort of peaks with the intensity of the session, as it were, as we get deeper
Hmm.
and deeper into stuff, the more open I am. Some people say I like to take it 15 to 30 minutes ahead of time so that I already come in kind of in the peak and I'm able to start off, hit the ground running. And some people say, I like to have the entire psychoactive experience in the hour prior to the session. And then there's kind of like an afterglow for 2 to 3 hours where you just feel more open, much calmer, much less discursive thinking. The narrative mind is quieter. And so that's
Hmm.
also an optimal state for therapy. So it does really differ, but I'll tell you about my own therapy because certainly I can anonymize and tell you some stuff I've heard from
Hmm.
clients, and I'll be happy to do that. But I'll tell
Hmm.
you about my own therapy. I like to take it at the beginning of the session for sure. And my therapist and I do like to spend some time dropping into the body. accessing, what we call true nature, which is very similar to what IFS might call self, right?
Mhm.
The part of me that is self-compassionate, compassionate to others, that is sort of deeply aligned with integrity, that is free of the various distortions of the egoic thinking mind. So we spent some time just kind of dropping into that, and then seeking, is there anything here that really is calling out to be loved, calling out to
Mhm.
be held with compassion, to be understood. And of course, something arises fairly quickly every time. And we
Mhm.
spend some time there getting to know the pattern that's arisen, or the part in parts language, getting to understand what images come with it. There is a way in which the ketamine state does kind of foster some creativity. Sometimes the images come more quickly, sometimes the associations come more quickly. And in a sense, they're quite full. It can be really a re-simulation of the origins of whatever pattern it is that I'm working with. And
Right.
from then on, it really is just a bit of, I do a lot of somatic work and parts work with my therapist at this time. So it looks very much like a regular session. It's
Yeah.
just that I'm so much more at ease. I'm so much more connected to my true nature, as it were,
Mhm.
that things just feel kind of seamless.
Yeah.
I could share happily some stories from past patients that I interview and talk to a lot of our patients and
Uh-huh.
ask them how it's going in therapy. And there's also this great little interview reel we did with a couple of patients. Happy to send it over if it could, if it would be
Mhm.
good in
Sure.
the show notes.
Sure. Yeah.
Um,
Yeah.
yeah,
Yeah.
where there's this woman who just says, all the stuff that I usually think, oh, I don't want to go there. Suddenly I just think, yeah, I can go there today. And that reminds
Mhm.
me of a particular patient of ours that I spoke with,
Mhm.
who said he brought in his ketamine to a session where he was hoping to explore sort of some of the anger that he felt in his marriage of like 15 years or so.
Mhm.
And as he took the medicine and he dropped into his body and started, they're a bit more of a CBT orientation, their therapist. I hadn't spoken to the therapist, just to him, but that's my
Mhm.
gathering of what he told me. But
Yeah.
even with something like CBT, which is less mindfully based, less somatically based, at least usually, obviously some therapists
Right.
incorporate a
Right.
lot of that in.
Uh-huh.
They were really able to identify in a much clearer way, like some of the thoughts that he wasn't so aware of, that underpinned some of the anger that he felt toward his wife, that he sort of felt like he always had to be the one to take care of everything. He was the responsible party at all times, whereas she sort of got to live free and live her life as she will. And through the ketamine state, which does provide this kind of third person perspective at times, it's not
Mhm.
like you're out of your body, you're not dissociated, but that partial dissociation allows for a shift in perspective that's sufficient enough to see things with new eyes. He was able
Mhm.
to sort of see, like, first of all, my wife is pregnant right now. Like, of course,
Mhm.
I want her to be as relaxed as possible. She's growing our child. That was something that
Mhm.
hadn't been clear to him before. But also, he
Right.
was able to sort of go back and see some of the origins of this feeling of always needing to hold up the world. He said he described an image that came up to him of Atlas, like, I
Mhm.
am I am the guy holding up the world. And he was able to
Right.
connect to some old memories of childhood where he was parentified in particular ways. And the ketamine just provided this beautiful, safe, bubble in which he was able to explore this without being overwhelmed by any of it, make these connections joyfully. And then his therapist did provide him with some suggestions on how to journal about it, how to integrate, how to be soft with himself in the following few weeks.
Yeah.
And I mean, it was a really transformative session for him. He really felt
Yeah.
like
Yeah.
he got some
That's a
insight there.
Yeah, that's really, really cool. It's really kind of as I think about it, kind of a catalyst for using kind of cognitive CBT language as a catalyst for a reframe that was pretty significant. Yeah.
Yeah.
Yeah. That's great. That's great. So, if people are interested in maybe the training or
Yeah.
maybe getting started and finding out more, tell us the process for that.
Absolutely. So the website is, as you said, joyous.team, and then it's just joyous.team/ketamine. therapy for the
Uh-huh.
therapist. The process there is pretty simple. Right now, you go ahead, you sign up, you'll start receiving a few emails, a few text messages from me just saying, welcome. We like to give therapists coupons that they can pass to their own clients,
Mm-hmm.
which will later, we want to incentivize clients to say, yes, I'm in therapy. And then through the coupon, we can kind of identify, okay, this is the therapist that they're with too. And at this point in time, there is a very basic training available on the therapist portal. It's only a couple of hours and it touches upon some of the most important safety components and some of the clinical framework that is most useful. And many of our
Mm-hmm.
therapists have just found that to be enough to hit the ground running. But as I said, we know that therapists want training, they want to know what's
Mm-hmm.
going on. And so the certificate program should be out in the next 2 to 3 weeks. And so for
Okay.
those
Good.
therapists who just want to sign up and wait for that to happen, great.
Right.
We will be there for you within the next couple of weeks.
Right.
And there's no we as a company don't interfere with how you and your clients deal with money or scheduling or anything like that. It is a
Mm-hmm.
very loose program in that sense at this point. We just
Mm-hmm.
kind of want to support you in feeling comfortable doing what you're doing. I'm in the process of putting together two tools that one is client facing and one is therapist facing that suggests session protocols, outlines
Uh-huh.
based on
Okay.
the therapist facing one is a case conceptualization. What do you think the client is working on? What are some blind spots? What are some strengths? Any risks involved? And what kind of theoretical orientation do you work with? What interventions do you prefer? And then it really suggests, all right, spend the first 5 to 10 minutes, doing this, spend the next 35 minutes exploring some of these questions, perhaps exploring these parts, perhaps, whatever it is that you like to do as a therapist.
Mm-hmm.
And then here are some integration suggestions. Here are some journaling prompts that you might suggest to the client. And of course, these is all very loosely held, no rigidity, just suggestions. And the reason that we did that is because therapists still wanted to have the confidence of what do I do with this medicine? Our
Right.
original thought was you just do what you're already doing.
Mm-hmm.
Your clients coming in more ready, but you just do what you're already doing. But people still felt nervous. We were like, okay, let's give you some help.
Yeah.
So that'll be therapist facing. I'm building one that's client facing too, where they can sort of say, what do you want to work on today? I want to process and release something. I want to grieve some grief. I want to come to understanding. I want to make a decision. So, and then there's some follow-up questions that then also suggests to the therapist, here are some things that you might want to work on.
Right. Right.
Yeah.
That's great. That's great. We'll have links in the show notes and show summary.
Cool.
One question that comes to mind for me, Sharon, is how does prescribing work with all of
Yeah.
this? And that was,
Sure.
I forgot to
Yeah.
ask
Yeah.
that earlier. Yeah.
No problem. I think we're live in 29 states. Every once in a while, we add a state or drop a state due to various
Hmm.
legal reasons over telehealth. So the providers that we have are licensed in those 29 states. The
Hmm.
telehealth appointment lasts about 15 to 20 minutes, where they review all of the patient's medical and psychiatric information, make sure that nothing was missed, and then talk about the treatment itself, make sure that the patient understands what's going to happen, answer any questions that they may have. And if everyone agrees they're on board, they think it's a good idea, the telehealth prescription goes into a network of pharmacies that are compounding pharmacies that we work with, and they are able to prescribe specific strengths. So everyone
Hmm.
starts with 60 milligrams. Well, not everyone. If you tell us that you are particularly sensitive to medication, we'll start you with an even lower one, which is 40 milligrams. So, but the average patient receives 60 milligram troches, but then they're asked to, gosh, it would have been smart to bring my troche pack, but I didn't think about that.
Hmm.
They're asked to then split the dose into four for their first experience, which is
Hmm.
15 milligrams. And the bioavailability of the form that we use, which is called buckle, that means cheek. So you kind of put it
Hmm.
between cheek and gum like tobacco snuff. The
Uh-huh.
bioavailability is low. It's like 25%. So with 15 milligrams, you are getting like 4 milligrams of ketamine in your system.
Hmm.
And most people barely feel that. It starts
Hmm.
very, very low and very,
Hmm.
very gentle. And we raise it
Hmm.
only after a couple of days if there are no side effects, and again, raise it until we feel that we've achieved clinical significance
Right.
in your symptom prompt.
Yeah. So what's the typical length of treatment with this?
Yeah. The average patient, I believe, is with us for 5 to 8 months.
Okay.
Yeah.
Okay.
And we're very
So,
happy with that. We want our patients to graduate. We are not here
sure.
to ask people to be on ketamine forever. That's not what it's about. So,
Okay. Well,
yeah.
perfect. Well, perfect. Well, Sharon, I guess we need to be mindful of our time, and I'm so glad we got
Yeah.
to have this conversation. And again, the website is joyous.team. Is that correct?
Joyous.team. Yeah. And the
And
therapist site is joyous.team/therapy.
okay, great, great. And again, we'll have links in the show notes and the show summary for people to find that easily. And
Amazing.
hopefully we can have another conversation
I would love that.
here soon. Yeah.
Yeah, I would absolutely love that. Thank you so much, Gordon. What a pleasure.